Ici. D'accord, il y a une petite érosion cutanée, c'est rien du tout, hein. Ce n'est pas cassé. Vous vous souvenez de tout l'accident? Vous ne bougez pas la tête, madame. On durcit un petit peu, c'est pour éviter que ça bouge dans les virages, que vous ayez la tête qui bouge, hein.
The SAMU controller decides on the most appropriate place to send the patient.
Dans la mâchoire gauche et le bras gauche, la sensation de fourmillement.
D'accord. Est-ce que tu peux me passer le cardiologue de l'endroit se parer?
Having received a description of the patient's condition, the doctor's decision depends on the patient's illness or injury and the beds available in the various hospital departments he has contacted. The patient's treatment continues throughout the journey right up until he's taken in charge by the receiving doctor. Maintaining constant medical treatment in this way means the chain of care is never broken.
À 13h15, il a ressenti une douleur vraiment typique, précordiale gauche, irradiation bras gauche, mâchoire à gauche, qui est à 6 sur 10, sans autre signe fonctionnel, des sueurs associées. Ça a duré à peu près une demi-heure.
In order to ensure continuous resuscitation care, the SAMU also dispatches mobile intensive care units to transport patients from one hospital to another.
Il y a un 04 qui est de l'hôpital Foch, l'hôpital Cochin avec les motards.
This type of service is for patients who need to be transferred to more specialised facilities. If medium or long distance transport is necessary, the SAMU uses helicopters or planes. Emergencies involving premature or newborn babies and very young children are handled by the Paediatric Mobile Intensive Care Unit at the Antoine Béclair Hospital. The teams and highly specialised resources of this unit cover the Hauts-de-Seine province and often operate much further beyond.
Voilà. Ah, il faut 3 kg 550, hein?
In cases of mass casualties or disasters, the SAMU has a role to play within the Special Emergency Plan. It's responsible for taking care of the injured, sending victims to appropriate destinations, and setting up an emergency psychological unit. It also contributes to coordination during major epidemiological alerts and helps provide medical services to large populations. All these tasks are made possible thanks to rigorous medical procedures and constant maintenance of equipment. But the success of these operations is also due to continuous training of SAMU staff designed to maintain their familiarity with the latest developments in emergency medicine.
Et ça a été étudié récemment par différentes équipes. Ici un abstract récent de l'ERS.
The work of these teams in the field is supported by SAMU logistical services and the administrative and financial team at GASH. Within its role to ensure 24-hour emergency health care, the SAMU also houses the Biotel Alarm Call Centre. Financed by the Hauts-de-Seine Departmental Council, this is a remote surveillance system for elderly and disabled people. It's accessible 24 hours a day and thus enables this population to carry on living in their own homes. Other services, such as the Coroner's Department, also benefit from the facilities of the SAMU.
13, 14 et 15, insufflation.
Education and research are two fundamental functions of the Hauts-de-Seine SAMU.
Ceinture. Première étape, je bascule la tête en arrière, libération des voies aériennes. C'est-à-dire que le volume d'oxygène pur, le volume qui est là, va aller dans le ballon.
Appareil en charge. Restez à l'écart du patient. Appuyez sur la touche orange maintenant. Choc délivré. Analyse du rythme
The
cardiaque.
courses given by the Emergency Care Training Centre are mainly targeted at health professionals, but can also involve a wider audience.
L'hémorragie, on perd du liquide et des globules rouges. Donc ça,
Samu 9-2 also exports its skills abroad and coordinates European research programs.
elle va chuter.
Prevention is an integral part of the SAMU's function. It contributes to drawing up safety plans for hazardous sites or ongoing building work and takes part in mock exercises. Similarly, the SAMU prepares for all types of new hazards, epidemiological, accidental or criminal. At the same time, it offers the province's hospital staff training in special procedures and the use of equipment. Lastly, the SAMU offers assistance in international humanitarian operations in the event of human or natural catastrophes. The first link in the emergency healthcare chain outside the hospital, SAMU has succeeded in adapting to changes over the years. Today, the skills and involvement of its teams make it a key resource for emergency medical assistance. Thus, it continues to develop, to carry out new assignments, and to stay constantly responsive to new needs.